there was the Health Equity Symposium in 2014, which was about building health equity capacity generally. And one of the pieces we did at the symposium that I think was quite important was the piece of votes. We had people vote with their feet, and you got to decide, or the people that were here got to decide, what do we want to see happening next? What are some of the priorities? And in fact, equity data collection was considered one of the main, was in fact the number one question, or the number one idea that people had. So the question then became, well, what are we collecting? What's happening currently in the Mississauga Halton LHIN? And that group created a survey to it's not about collecting the data, but the survey was, what data are we in the Mississauga Halton LHIN actually collecting? We did get 103 survey responses. Overall, we had 48 out of the 77 LHIN-funded organizations respond. We had 20 out of the 48 community support service organizations. Those are organizations we also asked this question to respond, and we had 40, so that's 42% response rate that we got. And we appreciate every one of your answers, because the more answers we get, this time, next time we're asking something, the better decisions can be made. That's the whole beauty about data and data collection. So when we ask the question, what does your organization or group ask clients about which language they would feel most comfortable? 70% said, yes, we in fact do this. When it came to French languages, surprising. I thought this was somewhat surprising, but only 35% actually said, yes, we asked that question. That may have to do with the fact that a lot of people think of it as being included in the languages before that question, in the one before. Born outside Canada, 46% said they are asking this, and 72 of those who asked the question actually went on to ask how long this person had been living in Canada, because for some of us, that would include myself, I've been here for, I wasn't born in this country, but I've been here for a really long time, and so I know how to negotiate this system way better than the one that I was born into. Racial or ethnic group, we had 46% said yes, 49%, so that's fairly close. Disability or health conditions, now that one is a good one, so that's 85% actually asked the questions. Gender and sexual orientation. Gender in terms of, and I think that the piece here is the important piece is that questions around transgendered and transsexual aren't only asked by 10%. To give you an example, but it's actually relatively low. I'm surprised about this. And then there's the question about the sexual orientation, and 81% of them said no, they don't ask that question. Income, 46% did not ask the question. Education, only 42% asked the question about the highest level of education completed. Other sociodemographic data that was listed, 36% said yes, they ask other questions, and those are some interesting questions. Housing stability, food security, marital status, that's often a general question anyway, immigration status, religion and spiritual needs. Those are really, really good questions. Maybe not asked by a sufficient amount of organizations, if you ask me, from my perspective. And so I'm going to leave you with the summary slide to show you in some sort of a rating of which ones of those are already done. So where are the apples? Those kind of, where you've already reached, or organizations are already reaching a really high level, and where around disabilities, language, and gender, where organizations, the organizations in the Mississauga Halton LHIN, where there is improvement needed. So we'll put some of the boulders out of the way and level up.